Okay, good morning, everyone. So my name is Paul Leonard, and I'm the program chair for our Masters in Diagnostics and Precision Medicine. So before I tell you about the program, I'd like to maybe just introduce you to, I suppose, the current state of treatments or drugs that we have today. So let me just change. So every day, millions of patients are taking drugs that may or may not benefit them or treat their disease. If we look at the top 10 drugs in the US, we can see that some drugs, such as Humira here, can treat as little as 1 in 4 patients, while other drugs only treat 1 in 25 or more patients. And actually, in fact, if you have high cholesterol and you're taking statins, as little as 1 in 50 patients sometimes benefit from disease. So there's huge imprecision in the current treatment, the way we treat patients. So why is this? First of all, traditionally, when a patient presents a clinician, diagnosis is based on symptoms. So if you have the same symptoms as somebody else, you get the same drug treatment as somebody else. But we also know that we're all different. So when we say we're different, the way we can actually, our bodies can break down drug treatments, such as pharmacogenomics, we call this, it's different from person to person. So we respond differently in our bodies to how drugs are. We also sometimes generate immune responses against the treatment that's there to try to treat our disease. But in particular, which is a big factor here, we now know that even when patients come into the clinic with the same symptoms, we can stratify those patients into subtype of disease. And depending on the subtype of that disease, those patients should take one treatment or another. So with this in mind, so what is precision medicine? So precision medicine is a healthcare approach that utilizes molecular information such as genomics, proteomics, things like transcriptomes or metabolomics in our body, to better diagnose, prevent, and treat human diseases. So the overall goal is improving healthcare for the patient. And there's 4 goals that we sort of look at in precision medicine. First is to find the right treatment for the right patient, and especially at the right time. We want to be able to diagnose that patient early so that the drug treatment can have an effect. We also know, as we mentioned there, that drugs can be broken down differently or metabolized differently inside the body. And this means that we have to be able to identify the right dose for the patient. So it's tailored more to the patient. And while precision medicine is already having a big impact in developing new treatments for patients that weren't there before, if we look at the next 10 years, the trend is enormous for precision medicine. We're going to see a lot more treatments, new companies, new roles, new careers in precision medicine, where we're able to stratify patients differently, and we're able to identify the right patient for the right drug for the benefit of that patient. So I just want to give one example of a precision medicine case study before we talk about the program here in DCU. So this case study is a case study of a patient called Nicholas Walker. He was a very healthy young toddler. Until he was around 2 years old, he started developing inflammatory bowel disease type symptoms. And we mentioned the symptoms here, where he got progressively worse and worse. And over the next 2 to 3 years, Nicholas spent more time in hospital than outside of hospital. He had over 100 surgeries in that period, or surgical procedures in that period. And his prognosis was getting worse. He was in intense pain. So the clinicians had treated his symptoms as you would in any sort of case, but to no effect. So when they're lost at this stage, they knew that Nicholas was a one in a rare case, a 1 in a billion type of case. So they looked at precision medicine. So they got in contact with scientists who were able to sequence Nicholas's genome, and they identified a mutation in a gene called IXAP, which is responsible for immunodeficiency-based disease. So it lowers your immune response. So knowing this, they knew they were able to treat these patients who had this type of mutation with a bone marrow transplant, essentially giving them a new immune response. and this drastically improved Nicholas' condition, where he could go and live a relatively healthy lifestyle. So Nicholas is actually the very first case of a child being treated with precision medicine, and this shows you the power of being able to look at the sort of molecular signatures of a patient to be able to tailor a treatment for the patient's benefit. So in DCU, we have our program, which is a Master's in Diagnostics and Precision Medicine, where students learn the latest advances in science, technology, and medicine. And we're teaching the students how we can detect disease and conditions more accurately. Where with this, we can also develop treatments that can be approached on a more individual basis, a bit like Nicholas's case there. And also we can identify those patients at a risk for developing the disease. So we also want to prevent the disease from occurring. So the program here in DCU is a 1-year full-time master's, or up, as Dave said, for his programs, up to 4 years part-time. And that's depending on how many modules a student decides to take in any given year. But the program is slightly different. It's delivered in a hybrid learning approach, and this is to give the students flexibility in their learning. So in DCU, we have classroom delivery across a number of different modules, but we also have a partnership with Arizona State University, where students have access to their online learning portal from the International School of Biomedical Diagnostics. So students can log in with their ASU login credentials, and they can follow modules and online assignments through the ASU portal. So this really gives students the flexibility to learn both in class and online. The program is a 12-month program or 1-year program, where we're broken into 3 semesters starting in September and then finishing in August of the following year. And our first semester, we have 5 modules. One of them is a 10-credit module, which focuses on things like targeted therapeutics and diagnostics for cancer. And this is one of the programs here, or one of the modules that I lecture into. We also have a module that's run by Arizona State University, really looking at advances in molecular diagnostics for precision medicine. And then we have sort of core modules that bring students up to date on sort of latest advancement, how the field, the scientists are using our immune system to develop new treatments or reagents for diagnosing disease better. And we also look at how disease mechanism of actions can occur in things like cell biology. Our second semester is quite similar, where we have a 10-credit module called Precision Medicine 2, but in this particular module, we focus on targeted therapeutics and diagnostics for inflammatory-based disease and other inherited diseases. We have 2 modules that are in partnership with ASU, and these modules are designed to look at sort of big data. So precision medicine incorporates a lot of omics-based data, so a lot of genomics, proteomics, and other type of data, which these programs skill scientists with techniques in bioinformatics and biostatistics. We also have sort of professional type of skills and technical skills training. So these are very much focused on industry relevant skills in precision medicine, sort of transversal skills that the students can develop and bring into industry. In our third semester, students have 2 options. They have an option to undertake a 3-month research project. This is run in the School of Biotechnology here in DCU, where students research a topic, and they also work in a 12-week period in a research lab. And at the end of that, they prepare their scientific report and defend that sort of in a thesis style, mini viva type of style presentation. But students also have an option to undertake master classes in precision medicine. And these are sort of a compressed 3-week in-depth training on key techniques in precision medicine. Students are then given a mentor in the School of Biotechnology, where they also do desk-based research, things like writing a grant proposal, for instance, these transversal skills that are very important for career. And again, the students present their research in a sort of a mini Viva type presentation and a question and answer session. So it's about 50% here that the students tend to choose, but once you register on the course, you have a choice to choose either of these streams. So wherever students go, we have a LinkedIn page where we track where the students, past students, have gone in their careers, and also allows the students to stay in contact with each other. So, a lot of the Masters in Diagnostics and Precision Medicine students end up in pharma or a diagnostic or life sciences company, but quite a few also look to pursue further research careers. So for instance, I have a graduate from last year who was working in my lab. She's developing a diagnostic assay for colon cancer, for instance, and she's looking to do further research. Other students in the past have gone on to sort of clinical based studies, but overall the feedback from the course has always been very positive. Students find it highly enjoyable, for instance. They find that sometimes they identify key areas that they didn't realize they're very passionate about, and they want to follow further research in that area, for instance. Students feel they've gained invaluable skills that are both relevant to academia and industry. They find that they can position themselves well for industry-based jobs. They tend to be very happy with the broad application to different diseases such as autoimmune, cancer, genetic-based diseases, and how these come together. They tend to like to see how we learn how the industries looks at mechanisms of disease to see how we can treat those patients. But as Dave mentioned in his course, we have only 30 students in the class. The class is capped at 30. So it means that we have a lot of engagement with the students. The key here is the students be able to feel that they can meet their lecturer staff and ask whatever questions they need, if that's after lectures or outside of lectures, but they feel that there's staff are always there to help as needed. So with that, in the purpose of time, I'd be happy to take any questions at the end. My contact details are here. So the entry requirements for the course are all online, and you can find that on the DCU webpage, but I'd be happy to answer any particular questions on that at the end.